It's my chase always going back. Hello, good evening. Somebody's already yawning. Are you not being funny? How you guys doing? We are just 19. There's everybody. They have to come home. Let me give them 5 minutes. They're in traffic. They had psychology today. Good evening. Oh boy. How did the weekend treat you guys? Good? I believe it was good. Structure and section of the cadaver. Oh, really? So the finals is disrupting the weekend, eh? Interesting. Mm, boom. So the final is not normal, right? It's very pathological. It's not true. I don't know why I don't believe that. You guys are more than ready. That's why a lot of some people are not here. They are like, what am I even learning new? What is new? You know? And it's true. I already did revisions for these things and I already did the video. So please, you do yourself a whole lot of good if you go back to those videos and look at them. 8:02, 3 more minutes. Does this seem recognize my hand? Mm. Hello, welcome. If your phone is not part of me, put that. Welcome, welcome, welcome. 1 minute to go. How many are we? 33. Okay. You're coming back from traffic, then? Okay. You guys are welcome once again to our revision today. So today we will be taking very few chapters, and we'll look at the entire video, images for the entire thing. I'm not going to discuss neuro with you guys because we already had a revision on neuro. If you've not seen the revision, please go. It's on the live stream, and also I made videos for the neuro. So kindly go back to it. Today I want to focus on the skin, the bone, and something else. Skin, bone, and something. I will find it. Okay. Okay, skin, bone, and muscles. Yes, that's what we discussed today. Then we will now look at pictures across border. All right. Yeah, skin, bone, and muscle. Thank you so much. Then we'll now look at pictures for the entire thing. In the pictures that are very important, like something you can look out for in any exam you're writing, especially this particular exam. All right. So that's what we do today. But for neuro, refer to the videos, refer to the live stream. And also for those two last chapters, the special senses and the autonomic nervous system, please refer to the two videos that was posted to you. From beginning to ending, I discussed several questions. Focus on those questions so that you don't say you didn't know, all right? Okay, because I won't talk about them this night. Okay, are we ready? We are 36 people, almost 40. Please, let's be fast. Let me advise you. You don't need your slide right now. Honestly, like 1 week to exam, you don't even need to be looking at slides. What you need to be looking at is questions. Solve a lot of questions. Master those questions. Know why they are the answers. So for this our review, we want you to forget about your slide right now. If it's open in front of you, keep it out. You understand? You don't even need pen and paper. You just need to think. So when I pose these questions, I want you to pretend like you are in the exam hall and attempt it. You get, even if you fail it, no problem. Don't copy what others are doing because you'll be alone in the exam hall. You feel me? So just focus, think about the answer, put the answer as fast as you can. You understand? If you fail it, you tell yourself, oh, I don't know this and I have to go look it up very fast before my exam. Do you understand? All right. So, and also the rule still stands, at least 15 to 20 people has to attempt. If you don't know it, please write not sure. Don't fold your hand. All right? Just write not sure. Good. So just write not sure, right? Or 911, then we can explain more, right? But don't fold your hands. Okay. So let's test the microphone. Which of the following is not found in the epidermis? We know the epidermis as a structure in the skin. We are starting with skin, yeah. So which one is not found in the epidermis? If you can hear me, I will give you options. The first one is melanocytes, the second one is fibroblasts, the third one is stem cells, the fourth one is keratinocytes, the fifth one is tactile cells. Which of the following is not found in the epidermis? Melanocytes, fibroblasts, stem cells, keratinocytes, tactile cells. Melanocytes, fibroblasts, stem cells, keratinocytes, tactile cells. 1, 2, 3, 4, 5, 6. You see? That's the problem. 6 people. So 33 people don't want to attempt the answers. I have time. I'll wait. So the answer is fibroblasts. All right. You need to know this. If you don't know it, please go back to that video and look at it. Where I discussed the. Did I do a video on skin? I can't remember if I did a video on skin. But we did a review on it. All right. So please go back to it. Okay. Okay, I didn't do a video on it, but we did a review on it. So please go back to the review. All right. Go back to the review. You can put it on a fast forward so that it will be moving faster. Then you look at the skin. Those questions is still the same questions I'm going to discuss with you today. So look at this question. Skin covering the dash has sweat glands, but no hair follicles. We have the forearm, we have the buttocks, we have the abdomen, we have the fingertips, we have the back. Forearm, buttocks, abdomen, fingertips, and back. Perfect. You guys have come to life. The answer is fingertips. You are very correct. Answer is fingertips. You are very correct. Aha. People have now this is what I'm talking about. I want them just put your answer. Look at this question. In which of the following regions will a subcute injection be administered? Stratum basal, stratum spinosum, stratum corneum, dermis, hypodermis. In which of the following regions would a subcute injection be administered? Stratum basal, stratum spinosum, stratum corneum, dermis, and hypodermis. Yes, fingertip is correct in that other question. You're correct. So we are in a new question now. Options: stratum basal, stratum spinosum, stratum corneum, dermis, epidermis. Yes, you guys are very correct. Hypodermis. You see, because you are fast, I am fast. It makes sense, eh? Thank you so much. You guys are correct. The answer is hypodermis. Look at this question. Which of the skin layers below is the most superficial? We have the basal lamina, we have the epidermis, we have the papillary layer, we have the reticular layer, we have the hypodermis. Which of the skin layers below is the most superficial? We have the basal lamina, we have the epidermis, we have the papillary layer, we have the reticular layer, we have the hypodermis. Exactly, the answer is epidermis. The answer is epidermis. You guys are so correct. Now, I will share my screen because let me see something. I've never used this question and answer part before. Hold on. I see something now. They say engage with your audience, question and answer. Let me see how it works. Never tried it before. This question. Start a question. I don't know how this thing works. Can you people see this? Which of the following best describes the composition of the dermis? Let me see how it works. I don't like it. Oh, but it looks nice. We can see, yes, we can see it. I don't like it. The thing is not doesn't have options. Okay. I don't know how it works. I will learn it later. I don't want to jeopardize our discussion. Learning, I'm learning what is it called? Yeah, I'm learning how to use this thing. How to use YouTube. So just let me share my screen so that you can see these options. Effects. You guys can see my screen, I believe. So for that question I asked, I'll share my screen. I'll put the options here. So these are the options. Let me make it bigger. Okay. Which of the following best describes the composition of the dermis, right? Describe the composition of the dermis. Okay. We have the collagen and living keratinocytes. We have collagen and dead keratinocytes. We have collagen and fibroblasts. We have elastic fibers, melanocytes, and we have elastic fibers and dendrites, dendritic cells. So you need to attempt this question as if you are in the exam hall. The question, I thought everybody can see the question I posted. Which of the following best describes the composition of the dermis? I really thought everybody could see that question. If you could not see it, that means you are not subscribed to the channel. Try to subscribe to the channel, right? Yes, you guys are so correct. The answer is collagen and fibroblasts. Collagen and fibroblasts is the major thing you will see in the dermis. All right? Yes, you are correct. C. Everybody should be able to get this one. It's a bonus question. Look at the options. The question says, which type of tissue is found in the most superficial layer of the skin? Which type of tissue is found in the most superficial layer of the skin? We have the simple squamous epithelium, we have the stratified squamous epithelium, we have the dense irregular connective tissue, we have the areolar connective tissue, we have the dense regular connective tissue. Come on, let's go, guys. What type of tissue is found in the most superficial layer of the skin? We have the simple squamous epithelium, we have the stratified squamous epithelium, we have the dense irregular connective tissue, we have the areolar connective tissue, we have the dense regular connective tissue. Come on, guys. Yes, the answer is stratified squamous epithelium. Remember, the stratified squamous epithelium is the epithelium of the skin. All right. In short, some questions they will say stratified squamous epithelium keratinized. You need to know the difference between keratinized stratified squamous epithelium and non-keratinized stratified squamous epithelium. All right. I'm not going to be discussing these things. I'm just here to test you, your ability. Huh? Look at this question. I'm not going to give you options. Anyway, the option is obvious. Second, third, fifth. Second, third, fifth. No, second, third, first, fifth, and fourth. Second, third, first, fifth, and fourth. Looking at a slide of the skin under the microscope, you note that the stratum basale is the dash layer of the epidermis in from the surface, like it's telling you from out to in. Basale is number what? Okay, you guys are so correct. The answer is fourth. The answer is fourth. Yes, come, let's somebody. Okay. The answer is fourth. Let me see. Yes, the answer is fourth, guys. Okay, that's good. Look at this question. Which of the following cells is largely responsible for the skin color? Which of the following cell is largely responsible for the skin color? We have the dendritic cell, we have the keratinocytes, we have the melanocytes, we have the tactile cells, we have the dead keratinocytes. Quickly, guys, quickly. Yes, the answer is melanocytes. The answer is melanocytes. That's what is responsible for your skin coloration. All right. For me, that is this dark, very, very black like this. It is I have a lot of melanin. Huh? So look at this question, guys. Look at this question, guys. Which layer of the epidermis consists of up to 30 layers of dead cells? We have the stratum basale, we have the stratum spinosum, we have the stratum granulosum, we have the stratum lucidium, we have the stratum conium. Quickly, guys. Which one? Basale, spinosum, granulosum, lucidium, conium. Quickly, guys, quickly. These are testing the microphone question now. You don't need to think too much. Chum, you should just give the answer quickly. If you are not able to comment, it means that you're not logged in from your YouTube app. You understand? So use the YouTube stuff instead of just the browser. I don't know how it works, but I think that's the cause. And also try to subscribe to the channel. Let me see. What question did I ask? I asked them, let me see. Okay, yes. What layer of the consists of up to 30 dead cells? Please, it is conium, all right? You guys are so correct. It's stratum conium, that's E. You guys are hot in this night, though. Like, nobody has even failed any question. Why? Why? I have less than 25 questions for skin for you. So, which of the following are associated with sense of touch? We have the fibroblasts, we have the melanocytes. Our leg is in cold water. Wow. On my own, I'm with a heater on my leg right now. Okay, we have the fibroblasts, we have the melanocytes, we have the keratinocytes, we have the dendritic cells, we have the tactile cells. Which one? Which of the following are associated with the sense of touch? If somebody touch you, you understand, give you one very sweet touch like that. How do you know? That's the question. All right. Which cell helps you to know and smile? You know, all those kind of things. You know what I'm talking about. You're laughing right now. Fibroblasts, melanocytes, keratinocytes, dendritic cells, tactile cells. You guys are so correct. The answer is what? The answer is tactile cells. Perfect. I love the energy. This is the kind of energy I'm looking for. You see, I'm beginning to respond. You know, initially I was talking slowly. Now I'm responding. Your energy will gets my energy high. You know, the fastest rate of mitosis happens in the dash. The fastest rate of mitosis happens in the dash. We have the stratum basale, we have the stratum spinosum, we have the stratum granulosum, we have the stratum lucidium, and we have the stratum corneum. So just the same options you had initially. The fastest rate of mitosis is in the basal because it has to, you know, it has to reproduce itself, you know, produce those cells that goes upwards. So very, very important that you know it. Most of all these other cells is developed from the tactile cell. Tactile cell is like the blueprint. So it has to develop a lot. It's very, very fast. All right. It's very important that you know that it is stratum basal. And that's why the cancer always targets that basal. All right. It targets it a lot. But I'm not discussing pathology right now. So look at this question, guys. Yes, basal is correct in that question. Look at this question. Which of the following cells stand guard against toxins, microbes, and we have the keratinocytes, we have the melanocytes, we have the adipocytes, we have the dendritic cells, we have the tactile cells. Which of the following cells stand guard against toxins, microbes, and other pathogens? Which one? You guys should answer so that I can get energy, like the kind of energy I had the day I drank cut ice. A friend of mine gave me cut ice. You know, I didn't drink it until I got to my house. When I drank it like this, I was hyperactive. I was extremely hyperactive when I. Sorry, not cut ice, cut water. It's cut water, cut water. Okay, I've told you guys the story. Eh, it's cut water. So yes, that day, I know when I came back, I drank it in my house. Jesus, I was not able to sleep. I was very hyperactive. You know, did I do live that day with you guys? No, I don't think so. As when I did live with you that day, I would have you would have noticed the energy, too much energy. No, naturally, I am very, very hyper. Naturally, I'm very, very hyper. Not talk of when I'm now hyper, you know. Anyway, that question, which of the following cells stand guard against toxins, microbes, and other pathogens? The answer is dendritic cells. Yes, you guys are very correct. All right. Is the soldier. So let's talk about fingerprints, guys. Let's talk about fingerprints. Look at this question. The other day they said I should go do fingerprints at NYPD. Yes, and I went. And everybody was so respectful. So look at this question. The fingerprints on things we touch are associated with what? Or with our dash. We have the dermal papillae, we have the dermal connective tissue, we have the stratum basale, we have the subcutaneous tissue, we have the subcutaneous adipose. Fingerprints left on things we touch are associated with our dash. Dermal papillae, dermal connective tissue, stratum basale, subcutaneous tissue, subcutaneous adipose. If you don't know it, right? Not sure. But yes, you guys are so correct. The answer is what? Dermal papillae. Please, you cannot forget this thing. No? Anytime you think of your fingerprint, look at it right now. Oh yeah, look. Look your fingerprint right now. What are you seeing on that fingerprint? Eh? What are you seeing? You see, those robo things is called what? Dermal papillae. It is the dermal papillae that makes that fingerprint what it is, all right? And if you see that kind of question in the exam hall, you should try to remember it. Okay. Let me see. Look at this question, guys. The thickest and the deepest layer of the skin of the dermis is the dash layer. The thickest and the deepest layer of the dermis is the dash layer. We have the areola, we have the keratin, we have the reticular, we have the collagen, we have the papillary. Areola, keratin, reticular, collagen, papillary. The thickest and the deepest layer of the dermis is the dash layer. Areola, keratin, reticular, collagen, and papillary. Come on, guys. This question, is it choking everybody? Is it choking you guys? I don't want to choke you guys. So yes, it's okay. You just put an answer and write not sure. That's fine. The thickest and the deepest layer of the dermis is the dash layer. We have the areola, we have the keratin, we have the reticular, we have the collagen, we have the papillary. Come on, guys. Not sure. Okay, people are not responding very much. That means you are not very familiar with this question. Please, the thickest and the deepest layer of the dermis is the reticular. Right? Just put it in your head now. Sing it. Thickest and the deepest layer, reticular. Thickest and deepest layer, reticular. Thickest and deepest layer, reticular. Do you understand? Dance with it. I know why I'm saying it too. Dance with it. Please, the answer is reticular. I have very few questions to leave. It's 34 minutes. I really want to be doing each of them with 30 to 40 minutes. All right. So I'll be done with this skin very soon. Now look at this question. Look at this question, guys. The hypodermis is characterized by an abundance of which tissue? We have the stratified squamous epithelium, we have the smooth muscle, we have the nervous tissue, we have the adipose tissue, we have the dense irregular connective tissue. Come on, guys. I have 12 people answering. Where are the rest 42? The hypodermis is characterized by the abundance of which tissue? Yes, the answer is adipose. It's adipose. There's a lot of fat there. All right. That's why sometimes we target them. Now, when somebody is physically abused, yes, it is adipose. Yes, you're correct. You guys are so correct. Maybe I should start giving gifts to people that answer very fast, consistently. Right? Look at this question. The skin discoloration most likely to suggest physical abuse is when you are in the clinic as a nurse, as a doctor, as PA, you examine a child, especially people in pediatrics, you examine a child, all right? What are you looking out for? We have pallor, we have albinism, we have the erythema, we have the hematoma, we have the jaundice. Quickly, guys. I love the speed. Gathering the next question. Hematoma. You guys are so correct. That answer is hematoma. All right. Okay, so if you know hematoma, how about the reddish? If you know that answer is hematoma, how about this? The reddish color of the skin of the lips is primarily due to presence of which pigments? Is it hemoglobin? Is it myoglobin? Is it melanin? Is it carotene? Is it keratin? Which one? Hemoglobin. You need to differentiate the difference between hemoglobin and the hematoma. Hematoma is in bruises. Hemoglobin is just the oxygen carrying component of the blood. All right, that's what makes things red. All right, so hemoglobin, the reddish color of the skin of the lips, is primarily due to presence of hemoglobin. Okay. How about anemia? How about anemia, guys? Which skin color? Which skin color is most likely resulting from anemia? We have pallor, we have erythema. Erythema, we have hematoma, we have albinism, we have jaundice. pallor. You guys are so correct. And what about those people you see in the clinic and you see them, they are yellow? Maybe children, you press their nose, they are yellow. Okay, jaundice. So you need to know the difference between erythema, jaundice, pallor, bruising, and cyanosis. All right? You understand? But what I'm interested, or what your exam is usually interested is jaundice, pallor, hematoma, right? Jaundice, pallor, hematoma. You need to be able to differentiate those things. Jaundice, pallor, hematoma. You need to be able to differentiate those things, all right? What's the time now? This is 41 minutes. I have to finish up. Okay, look at this question, guys. I like the way we are very fast. You see how fast we are? I love it because you guys have really read and you are now answering the questions recklessly. I want you to see yourself as if you are in the exam hall when you are answering this, responding to these questions, all right? Ethnic differences in skin color are primarily caused by differences in UV radiation exposure, the quantity of hemoglobin carried in the blood, the type and the quantity of melanin produced, the number of melanocytes, the number of keratinocytes. Quickly, guys. Quantity of melanin. Yes. So the answer is type and quantity of melanin. You can't forget this question because they test it a lot, in pathology. When you get to the pathology level, they test it a lot. That's a patch off. So look at this. I want to know if you guys know the difference between hemangioma, mole, freckle, flexion line, and friction ridge. Let me see. Look at this. Look at this. A dash is an elevated patch of melanized skin. An elevated patch of melanized skin. Is it hemangioma? Is it mole? Is it freckle? Is it flexion line? Is it friction ridge? The answer is mole. You guys have to know that. The answer is mole. Extremely important that you know that, all right? Where is this question? Okay, look at this question, guys. Yes, the answer is mole. You are very correct. Look at this question. What type of hair is present prenatally and usually replaced by birth? What type of hair is present prenatally and usually replaced by birth? We have Lanu, we have the peach, we have the terminal hair, we have the vellus, we have the downy hair. Quickly, guys, quickly. Quickly, guys. Okay, somebody asked the question. Yeah, someone said, what is the friction ridge again? So let me tell you some of the differences. I don't know what's wrong with my nose. So the difference is friction ridge is just raised skin pattern. You understand? On the palmar surfaces, all those loops you see on your skin pattern, that's friction ridge. But flexion line, you understand? We call it crease. You understand? They are just folds. The folds you see are joints. You see these folds you see are joints. You understand? Those are the that's what we call what flexion line. So there's a difference between friction ridge, flexion line, freckle. You understand? Freckle is usually small pigmented spots, right? Where there is an increased production of melanin. Then we have mole, which we already discussed, all right, which is just that elevation. Then we have hemangioma. Hemangioma is vascular. It's usually vascular tumor. Hemangiomas are usually vascular tumors. You feel me? Yeah, sometimes, but it's not a pathognomy of anorexia. All right, we have other pathognomies for anorexia. Okay, so the answer to that question is mole. The answer to that question is mole. We are gradually coming. Sorry, which question did I discuss last? What type of hair is found prenatally? The answer is downy. That's lanugu. Downy. All right. You have to remember that. Let me see the provide source of nutrition. Hold on. Let me check. Look at this question, guys. The circle of the developmental stages of hair. What's the circle? What's the circle? Quickly, guys, quickly. What's the circle? Come on, guys. Come on. We have more than 40 people on live here. A hair cycle consists of 3 developmental stages in which order? What's the order? Yes, you guys are so correct. The order is ACT, anagen, catagen, and the telogen. All right. Please, if you don't know that, please go back to that live that we did and look at it. Extremely important that you know this. Have I given you up to 25 questions? No? Yes. Yes, ACT. Look at this question, guys. Look at this question. Excessive hairness is called dash. Excessive hairness is called dash. Yes, you guys are so correct. The answer is hirsutism. Trying to get. Yes, the answer is hirsutism. It usually affects people that has a COPA. What was this pathology again? It's skin hanger proximal. So finally, for skin, I'll give you this question. Yeah, PCOS. Yeah. Sorry, my mind is divided between the screen and the question I'm trying to extract. Finally, guys, you see, skin is very straightforward. What is the white opaque moon often found at the proximal end of a fingernail called? Free edge, nail body, eponychium, lanu, nail root. What was the answer? What was the response? Or what was the answer, rather? Come on, guys. What's the white opaque moon? Found. That's white stuff found at the extreme. What's it called? Yes, you guys are so correct. The answer is lanu. All right, lanu. So, guys, let me write this thing down. Sorry. So, guys, that is for skin. I know you are happy that we are done with skin very fast, right? That's for skin. So let's jump over to bone tissue quickly. Are you ready? Somebody said, bring it on. Bring it on. Of course. So let's test the microphone, guys. Let's test the microphone. New bone is deposited by cells known as dash. We have the endosteum, we have the osteoblast, we have the osteoclast, we have the tunnel cells, we have the periosteum. What was the answer? Come on, guys. Two more people to respond for us to move. New bone is deposited by the cells known as that. This is testing the microphone. Everybody should respond. Perfect. Perfect. Perfecto. You guys are so right. The answer is osteoblast. Osteoblast builds. All right. Blast for building. So look at this question. Appositional growth is a process that dash. What is appositional growth? I hope you watched the video on bones, guys. Because if you watch the video on bones, you will just be smiling. Look at the questions. Appositional growth is a process that dash forms new bone on the surface of older bone, replaces older bone with new bone, eliminates blood vessels from bones, forms new bones from fibrocartilage, reduces the number of osteons. Quickly, guys, appositional growth. What's appositional growth? Yes, you guys are so correct. New on old. New on old. The answer is A. You guys are so correct. Look at this one. Now let's talk about the process of appositional growth. How does it happen? How does it happen? That's what this question is about. Look at the options. In appositional growth, new bone is deposited around a dash, central core of existing bone, small nerve, collection of osteoblast, lymphatic, blood vessel. Which one? Quickly, guys. At least now, some people has gotten a wrong answer. Because why will I be asking a lot of questions and nobody fails any question? And then somebody saying, Jesus Christ, am I the one? This is so interesting. I was wondering, like, how is it? Is it that the questions are so cheap that everybody's just getting all of them? I know you are so prepared, but at least you have to fail one question. Come on now. If you don't fail one question, it means I don't know what I'm doing. Guys, the answer is blood vessel. Bones grow around where blood vessel is. That's how they get the nutrients now. Do you understand? They don't get the nutrients from core. They get it from blood vessel. You understand? So please remember that. In as much as they grow on old bone, they grow on old bone close to where there is a blood vessel on that old bone. Please, the answer is blood vessel, all right? Now, look at this question. Look at this question. Which of the following is the correct sequence of events in the healing of a bone? I described this thing in the bone video. For people that saw that video, they will be smiling now and they'll be like, ah! Oh, I have to reduce this thing so that you'll be able to see it properly. They'll be like, ah, this boy said it too. So this is which of the following is the correct sequence of events in the healing of a bone fracture? Which one, guys? Quickly. Which one? Quickly, guys. Now, a lot of people are looking at that question. They're like, what is this boy? Okay, there are a few people. That's fine. The answer is C. When hematoma forms, that's the first thing. After that, there is something we call soft callus. All right. Even prior to that, there was a question I was supposed to ask, but I said no. I didn't want to ask that question because yeah, okay, the question says soft callus forms during dash. The answer is the healing of a fracture. So when you hear soft callus, it's healing of a fracture, even hard callus. All right. So we have the answer is C. We have hematoma formation, we have soft callus formation, then hard callus formation. This is AP1. This is 150 by 150. No, this is AP1. Hello. So hematoma formation, soft callus formation, hard callus formation. So you remember hematoma forms first thing, because that's what you see when you abuse somebody. Then after that, it starts healing, right? How does it heal? Soft callus. Then from soft to what? Hard. Then after that, bone remodeling. Does it make sense? So put it in your head. That is the sequence. Check it now. No stress. I don't want you guys to be stressing. Okay. Mm. So this is a physiological, pathophysiology question. It's a pathophysiology question, all right, which you ought to know. Look at the options. There are two dash there, two blanks. The result of blood calcium and phosphate levels being too low for normal deposition in the softness of the normal deposition is a softness of the bones called dash in children and dash in adults. What is it called in children? What is it called in adults? Quickly, guys. So rickets is the same thing as osteomalacia. It's just the age, all right? For pediatrics, we call it rickets. For adults, we call it what? Osteomalacia. So the answer is B, guys. No, this is pathology. I don't pathophysiology. Mm. Look at this question, guys. I want you to read the question and understand it before you attempt it. And look at the options. Blood calcium deficiency stimulates dash secretion, which leads to dash. Calcitonin, more urinary phosphate reabsorption. Calcitriol, more urinary phosphate excretion. Parathyroid hormone, increased osteoclast activity. Growth hormone, increased osteoblast activity. Thyroid hormone, less urinary calcium excretion. Quickly, guys, what's the answer? Blood calcium deficiency stimulates dash secretion, which leads to dash. Yes, you guys are so correct. Parathyroid hormone, when there is low calcium in the blood, parathyroid hormone is secreted, and immediately it is secreted, it increases what osteoclastic activity. What happens? Osteoclastic, breaking down of bone, cutting bone, cutting bone, cutting bone. So when it's cutting bone, the calcium in bone pours into the blood. Does it make sense? So the blood calcium rises. Physiology is so interesting. Look at these guys. I'll call the options. Or maybe I'll just post it. You need to read the questions, understand it, then attempt it. Synthesized by the combined action of skin, kidneys, and liver, DASH promotes bone resorption, but it's also necessary for bone deposition. Growth hormone, testosterone, estrogen, calcitonin, calcitriol. Quickly, guys. Quickly, guys. Please, I need you to attempt these questions as if you are in the exam hall, all right? Don't look at your slide. Yes, you guys are so correct. The answer is hypo. The answer is what am I even talking? The answer is calcitriol. Yes. What am I even saying? The answer is calcitriol. Yes, you're correct. Huh? E? You're correct. Look at this question, guys. Which of the following does not put women at risk of hypocalcemia? I was already on this question when I was talking about the other question. Which of the following does not put women at risk for hypocalcemia? We have lactation, we have pregnancy, we have removal of parathyroid glands, we have removal of the thyroid glands, we have lack of exposure to UV radiation. Quickly, guys, quickly. Quickly, guys. Which of the following does not put women at risk for hypocalcemia? It's question mark. Which of the following does not put women at risk for hypocalcemia? Yes, the answer is removal of the thyroid gland, guys. The answer is D, not C. It can't be C because C, removal of parathyroid glands. Just some questions ago, one question behind, we discussed about the effects of parathyroid on calcium, right? You understand when calcium is low, parathyroid is produced. It helps to increase calcium. Now, which of the following does not put women at risk? You understand? Lactation puts women at risk. Pregnancy puts women at risk. When you remove parathyroid, it puts women at risk. Calcium exposure to UV radiation puts women at risk. You may ask how. The reason is because when you are lactating, there's calcium in breast milk. It's going out. So it's reducing the calcium the woman has. You understand? Reduces the calcium the woman has. Pregnancy reduces the calcium the woman has. When you remove parathyroid glands, you're removing the amount of calcium the person has. But thyroid gland does not, because parathyroid gland is actually a different gland from thyroid. It's just that it is around it. Do you understand? Yes, UV is very, very important to synthesize calcitriol, so which is involved in calcium. Okay, so the answer to that question is removal of thyroid, not removal of parathyroid, removal of thyroid. Look at this question, guys. So some of these questions are very technical. You need to, avoid any distraction. Anybody that is there distracting you, tell the person to leave you alone. Which of the following is not a function of parathyroid gland? Parathyroid hormone, rather. Let me give you the options. Which of the following is not a function of parathyroid hormone? We have promote calcium reabsorption by the kidneys. We have stimulate osteoclast activity. We have lower blood calcium. We have promote calcitriol synthesis. We have inhibit osteoblast activity. Which one? Quickly, guys. Come on. 2 more people. Yes, the answer is C. The answer is C. The answer is C. Lowers blood calcium. Lowering blood calcium is not a function of PTH. All right. Instead, the function of PTH is to what? Increase blood calcium, not lower it. So that's just a very straightforward question. There are some questions you see in exam hall and you don't even need to think 2 times for you to answer it. Look at this question. Calcium plays an essential role in the following except we have muscle contraction, we have exocytosis, we have blood clotting, we have DNA synthesis, we have communication among neurons. Which one is the answer? Quickly, guys, quickly. What happened to the energy that you guys brought? You guys brought a very strong energy, and suddenly you guys are now lacking in energy. Eh? Do you need energy drink? Do you need energy drink? You need hot water? Calcium plays an essential role in all of the following except dash. Muscle contraction, exocytosis, blood clotting, DNA synthesis, communication among neurons. What was the answer? Yes, the answer is DNA synthesis, but calcium plays a role in muscle contraction, exocytosis, blood clotting, and communication among neurons, but it doesn't have anything to do with DNA synthesis. Okay. So the answer is DNA synthesis. Someone is looking for energy drink. No, hot water is energy drink. Told you it gave me energy. Don't you know alcohol is energy drink? Alcohol is energy drink because alcohol, when it breaks down, what does it break down to? Break down to sugar now. Yeah, it's a simple sugar. And when you have a lot of sugar in your body, right, and you breathe oxygen, it reacts with sugar, gives you a lot of ATP. Why do you think people that are diabetic will tell them not to take alcohol? So it's energy drink. That energy drink you take, is it not sugar? Put your leg in cold water. You are sleepy. Okay. When you take it, you feel sleepy? Yeah, you feel sleepy. That one is different from energy. Feeling sleepy and being tired is 2 different things. Feeling sleepy is because it goes to your brain, right? That's feeling sleepy. But energy, it gives you a lot of energy. If you do something at that moment, that's why some people like doing if when they take alcohol. You feel me? Having beer. Yes, beer is also alcohol. It also gives you energy. Energy. Use it well, don't use it for evil. The process of dissolving bone and returning its minerals to the bloodstream is called what? Is it mineralization? Is it mineral deposition? Is it crystallization? Is it resorption? Is it ossification? Mineralization, mineral deposition, crystallization, resorption, ossification. Come on, guys. Process of dissolving bone and returning its minerals to the bloodstream is known as dash. Mineralization, mineral deposition, crystallization, resorption, ossification. What's the answer? What's the answer, guys? The energy is going down. Energy drink in loading. So the answer is resorption, guys. Please, the answer is resorption. The answer is resorption. I have very few questions to leave to go on bone. Very few. Okay, look at this question. Look at this question, guys. A growing long bone in a child has only two areas of cartilage at the epiphysis. These two areas are the dash. We have the elastic cartilage and epiphyseal plate. We have the epiphyseal plate and epiphyseal line. We have the primary and secondary ossification centers. We have the fibrocartilage and the articular cartilage. What's the answer, guys? Quickly, guys. Quickly, guys. Yes, the answer is articular cartilage and epiphyseal plates. That's E. Please, if you don't know it now, you need to sing it so that it will enter your head. Now, since we all know that answer. How about the Wolff's Law? Have you guys heard the Wolff's Law? If you tell me no, you've not heard it, that means you've not seen the video and you have not been in my class. Because I was singing it in that video. I almost sang a song with it. So what Wolff's Law of bone explains the effect of what? Different diets on bone elongation, mechanical stress on bone remodeling, temperature on bone growth, age on bone thickening, sex on bone widening. Wolff's Law on bone explains the effect of what? Come on, guys. Come on. If you're not sure, just write not sure so that we can move. We have 47 people here, so I'm not expecting less than 20 responses. Come on, guys. The faster, the better. I really need to jump from here to the last this so that we can do these pictures before people start getting tired. Okay, you guys are so correct. The answer is B, mechanical stress on bone remodeling rather. Mechanical stress on bone remodeling. Do you understand? So the law, for people that have not heard of it, because I'm sure there are some people that have not seen these videos, all right, and we're not listening when I mentioned it. It's a very simple thing, right? The law states that the bone adapts to the mechanical stress placed upon it. Simple. So meaning that when you increase loading or stress on a bone, like people that are gymming, you understand, when you gym, when you increase the stress you put on your bone, right, the bone becomes denser and stronger. There's more osteoblastic activity. So there's increased osteoblastic activity when you load your bone or you stress it. You understand? That's bone deposition. But when you don't use your bone, like people that don't like going to gym, like me, maybe that's why my leg is paining me now. You understand? So when you don't use it very well, right? Decreased stress or loading, the bone becomes what? Weaker. It becomes very, very weak and less dense. Why? Because you are not using it. So okay, fine. Since you are not using it, let it break down. There's a lot of what osteoclastic activity. All right, that's bone resorption. You understand? So like all those astronauts, people that are astronauts in space, they cannot lift there. So because of that, they experience significant bone loss due to lack of mechanical loading. The bedridden patients, why do you think their bone breaks most times? Because that's a prolonged immobilization makes the bone to break. That's something we call what osteopenia. All right. But people, you see these people, athletes that run, do a lot of things, their bone becomes very, very strong. You understand? So I hope you guys get the concept of Wolff's Law. So if you see it in your exam anytime, any year, you will not forget it. So I have a couple of questions to go. But these ones are more like test the microphone question, something you already know. Let me look for something. Okay, anyway, let's just... Because these things that I think that these questions I'm seeing like that looks easy now, some people may end up failing them. So, or failing things when it comes out like that. Bone elongation is as a result of cartilage growth, muscle growth, osseous tissue development, fibrous membrane adhesion, dense irregular connective tissue adhesion. Which one is the answer? Nobody has responded. What's up? Is this one difficult? No, it's a test the microphone question now. Come on. That's the microphone question now. I was thinking everybody would have would be singing and dancing with it. That kind of simple question. Yes, the answer is cartilage growth. You will have to give me energy now. The answer is cartilage growth. Cartilage growth. Yes, that's the answer. Cartilage growth. Look at this question. Mature bones are remodeled throughout life via a process known as dash. What's the process mature bone are remodeled? Quickly, guys. Yes, the answer is appositional growth. We've already done appositional growth, so I didn't expect. I expected everybody to know the answer to this question. So I'm about to end this. Please look at this question. Oh boy, I'm having headache. This is the first time I'm having headache for a very long time. Okay. Achondroplastic dwarfism is a hereditary condition in which the long bones of the limbs fail to elongate normally because of reduced hyperplasia and hypertrophy of cartilage in the dash. In the dash. Did I give the options? I don't think I gave the options. So let me see. Oh, I didn't give the options. Look at the options. We have the primary. Oh, some people really saw the video. We have the primary ossification centers. We have the secondary ossification centers. We have the primary bone marrow. We have the secondary bone marrow. We have the epiphyseal plates. What's the problem with achondroplastic dwarfism? Quickly, guys. Quickly, guys. Okay, you guys are all correct. You guys are so correct. You understand? The answer is epiphyseal plates. All right. The answer is epiphyseal plates. And you guys have to know that achondroplasia is just a hereditary condition, usually. All right. The long bones of the limbs fail to elongate normally because of reduced hyperplasia and hypertrophy of the cartilage, specifically epiphyseal plates. Right. Now, it's actually usually mutational. All right. That's why we say hereditary condition. It's actually mutational, and it's mutation in a particular gene. That gene is a fibroblast growth factor receptor, either 3, I'm not sure of the number, but it's FGFR, fibroblast growth factor receptor. All right. So normal process is disrupted. Remember the normal process from zone of resting cartilage to proliferating cartilage to hypertrophic cartilage to calcification to zone of ossification. You understand? So all these processes is altered because of what? That epiphyseal plate issues. All right. So because of that mutation that affects the epiphyseal plate. So that's what achondroplastic dwarfism is about. But this is not pathology class, all right? Pathology class, microbiology class, I'll take videos on, I'll do some videos on them, but it will be only for people that are members. Yes, so please, you can. So the YouTube gave me the this thing that some people can actually become members. All right, so you become members. I don't know how much it is, but you pay for membership. Okay, somebody's laughing. Somebody said this boy does not know anything in YouTube. I don't, honestly, I don't. My own is just to come and talk and go. I don't know that there's a lot of things. One day I woke up and I saw that I have 50,000 followers. One day, I'm telling you the truth. I just woke up one morning and I look and say, where did all these people come from? Is it these videos that I'm doing that these people are enjoying? So it was interesting though. Okay, but I will try to see if I can get up to 100,000 before the end of 2026. Okay, but that's by the way. The dash is the marginal zone of the epiphyseal plate where in children and adolescents. What am I even reading? Please look, that's the question there. Let me give you the options. That's the option. So the dash is a marginal zone of the epiphyseal plate where in children and adolescents, bone can be seen replacing the hyaline cartilage. Which particular marginal zone is it? Because that epiphyseal plate that we zones, right? Aha. So we want to know which particular zone this one is. I bought a heater for my leg. It's on my leg right now, but it's not doing anything. Please, if anybody has if you have a reference of a heater that works well, for knee joints pain, you should send me the link. All right. This one is not working. It's not even heating properly. Before you know it, the battery has died. So, which zone is that? Quickly, guys, quickly. Which zone is that? Quickly, guys. 44 people, and I'm getting only 7 responses. That's not encouraging. If you're not sure, write not sure. It's fine. All right. Just give me a minute. Let me get water. I'm having a serious headache. Oh boy. Yes, the answer is metaphysics. All right. That zone. Metaphysics. 2 more questions to go. Two more questions to go. Look at this question, guys. In endochondral ossification, the precursor connective tissue is the dash. which is replaced by bone. What's the precursor? If you know the endochondral ossification very well. I hope I'm not lagging now. In endochondral ossification, the precursor connective tissue is the dash, which is replaced by bone. What's the precursor, guys? Yes, the answer is hyaline cartilage. Very correct. Hyaline cartilage. So, if you open the bone cavity of an adult, the diaphysis of an adult, what do you find? What do you find? Do you find the periosteum? Do you find a hematopoietic tissue? Do you find red bone marrow? Do you find yellow bone marrow? Do you find compact bone? What do you find? Yes, hyaline cartilage is correct for that question. Yes, the answer is yellow bone marrow. So final question, going. Yes, the answer is yellow bone marrow. You're correct. Final question, going. Final question. Let's see the people that can get this final question. Everybody has to attempt it. You must have to attempt it, please. Please. Everybody, 44 people. I'm looking for 44 responses. Quickly, guys. Quickly. This is your final exam, you have to participate. Yes, guys, you guys are so correct. The answer is what? Lacuna and osteocytes, all right? Yes. So let me take it. Let's number 30. Right. Okay, so that's that for bone. What's the next one? Next one is what? Muscular system or muscular tissue? Is it, yeah, I know it's muscle. Is it muscle tissue or muscle system? Is it the tissue or the system? Because there are two different things. I think it's tissue. Is it the tissue or the system? Let me see. Okay, muscle tissue. Okay, thank you. Thank you. Thank you. Thank you. Thank you. What chip? What chip? Okay. Welcome from India, my India friends. Welcome. It's 9:47 p.m. here. We are in Eastern time. Okay, so guys, let's start with Michael Jordan. Michael Jordan was arguably the best player in professional basketball history. He excelled at jumping and sprinting down the court. Anatomically, one would expect him to have highly developed dash fibers in his lower limbs. We have red, we have type 1, we have slow oxidative, we have fast twitch, we have smooth muscle. He's testing the microphone. We are using Michael Jordan to test the microphone. I thought everybody will answer this question, but obviously I'm wrong. 50. 50. So he has a fast twitch, fast twitch muscle. Fast twitch muscles. Yes, fast twitch muscles. Sorry, I'm trying to take my time to be able to sort out these things. Look at this question, guys. I hope you watched the video on muscular tissue. Which muscle can contract without the need for innervation? Nervous innervation. Yes, you guys are so correct. The answer is D, smooth and cardiac, all right? The answer is D, smooth and cardiac. Look at this question. We are still testing the microphone, by the way. Look at this question. Which of the following is an accurate comparison of skeletal muscle to smooth muscle? Smooth muscle contracts more slowly but relaxes more rapidly. Smooth muscle contracts more rapidly but relaxes more slowly. Smooth muscle contracts and relaxes more slowly. Smooth muscle consumes more ATP to maintain a given level of muscle contraction. Smooth muscle depends on an oxy and on hey Jesus Christ, I'll bite my mouth. Smooth muscle depends on an axon to supply the calcium needed for contraction. Which one is the answer, guys? Quickly. Yes, you guys are so correct. The answer is C. Smooth muscle contracts and relaxes slowly, very slowly. What's the function of calcium channel blockers? What's the function of calcium channel blockers? They prevent calcium from entering the sarcoplasmic reticulum of the smooth muscle. They stimulate the calcium pumps in smooth muscle, thus preventing calcium from camodoline. They prevent calcium from exiting the sarcoplasmic reticulum in skeletal muscle. They prevent calcium from entering cardiac muscle, thus allowing down thus slowing down the heart rate. They prevent calcium from entering smooth muscle, thus allowing the muscle to relax. Option. What's happening? Is it becoming difficult? Come on, guys. Are we done responding? What's happening? Anyway, calcium channel blockers just block calcium from the sound. Block calcium. And we know the function of calcium for contraction. So when it's blocked calcium, you understand, it stops contraction and the muscle allows the muscle to relax. The answer is E. They prevent calcium from entering smooth muscle, thus allowing the muscle to relax. Simple. Okay. Hold on, I'm trying to. Okay, this question. Which of the following has the largest mitochondria? We have slow oxidative fibers, we have fast glycolytic fibers, we have cardiac muscle, we have smooth muscle, we have intermediate fibers. Let me post it. Look at the option here. Which of the following has the largest mitochondrion or chondria? Slow oxidative fibers, fast glycolytic fibers, cardiac muscle, smooth muscle, intermediate. Which one? Come on, guys, let's go. Come on, come on, come on. Which one has the largest mitochondria? Yes, the answer is C, cardiac. The answer is C, cardiac. All right. Yes, cardiac muscle. Why? Because anytime your cardiac muscle is tired, you die. You get it? So look at this question, guys. Why does one continue to breathe heavy after rigorous physical activity has stopped? The diaphragm is waiting for its acetylcholine to run out. The body requires more oxygen to restore levels of ATP and creatine phosphate. The lungs can't stop breathing until the heart rate slows down. Myosin heads need more oxygen to fully detach from actin. The kidneys require oxygen to dispose of excess lactate. Why does one continue to breathe heavy? Quickly, guys. Yes, the answer is B. The body requires more oxygen to restore levels of ATP and creatine phosphate. That's the answer. That oxygen helps it to restore the entire thing back to normal because it utilized everything. Everything was broken down, all right, during that activity. Okay. When you do exercise, you produce lactate, right? How does the body dispose of that lactate? Or what breaks down that lactate in the body? We have the kidneys, we have the liver, we have muscle tissue, we have sarcoplasmic reticulum, we have neuromuscular junction. 80% of the lactate produced by skeletal muscle is converted to pyruvate by the dash. Kidneys, liver, muscle tissue, sarcoplasmic reticulum, neuromuscular junction. The options: kidneys, liver, muscle tissue, sarcoplasmic reticulum, neuromuscular junction. Quickly, guys. I need a lot of people to respond. Come on, we are more than 50 here, more than 40 or so. Yes, you guys are so correct. The answer is liver. When we transfer phosphate from creatine phosphate to ADP, what's the enzyme that catalyzes it? What enzyme catalyzes this conversion? We have the myokinase, we have the creatinine, we have the CAMP, we have creatine kinase, and we have the ATP. Quickly, guys. The transfer of phosphate from CP to ADP is catalyzed by what? Which enzyme? Yes, you're so correct. The answer is D, creatine kinase. Creatine kinase, rather. Look at this question. It's a little clinical, but yes, the answer is D. Look at this question, guys. Which of the following individuals would have more mitochondria in their skeletal muscle? A 50-year-old sedentary computer programmer, a 22-year-old soccer player, a long-term hospice patient, a model on a reduced calorie diet, a newborn. Quickly, guys. Quickly, guys. Which of the following individuals would have more mitochondria in their skeletal muscle? Yes, you guys are so correct. The answer is B. It's a 2-year-old soccer player. So look at this question. Okay, fine. You guys are, that one is testing the microphone. Look at this one. Look at this question, guys. Which of the following is true concerning isotonic concentric contraction? Which of the following is true concerning isotonic concentric contraction? The muscle shortens but tension remains constant. The muscle lengthens but tension remains constant. The muscle tenses and shortens. The muscle tenses but length remains unchanged. The muscle lengthens and tension declines. Quickly, guys. Quickly, guys. Somebody say, is it D? Let me see, what's D? 1, A, B, C, D. The muscle tenses, but the length remains unchanged. God. No, when you're talking about concentric contraction, we are talking about length, right? Is it elongated? Does it shorten? Is it elongated? Does it shorten? So that's when we tell you what we are talking about. But that's a terminology tenses. We don't use it or in contractions. Tense is more like tone. Every muscle has tone. Short and tenses is not the same thing. Oh, okay. You are saying C. Okay. Sorry. Now I get where you are saying C. Okay, so you guys are doing well. For concentric isotonic, the muscle shortens, right? But the tension remains constant. All right. Remains constant. How about, sorry. How about this? How about this? Thank you. How about this, guys? Which of the following is true concerning isotonic eccentric? So please, in your exam, you should be specific. You should know which one they're asking you. Is it eccentric? Is it concentric? Is it eccentric? Is it concentric? So you should be very specific about the exam, what they're asking you, all right? Quickly, guys. What's the response? What's the answer? Why is the response suddenly slow? What is happening? You guys need water. Come and take water. You need water. I have a lot to in my house. Yes, it lengthens, it elongates, more or so. So the answer is B. The muscle lengthens, but tension remains constant. Right? Yes, B. Look at this question. Yes, the answer is B. You're correct. The answer is B. So tell me this one, since you know that one. If one nerve stimulus arrives at a muscle fiber so soon that the fiber has only partially relaxed from the previous twitch, the most likely result will be dash. Fatigue, spasm, incomplete tetanus, complete tetanus, flaccid paralysis. Which one? The nerve stimulus arrives at a muscle fiber so soon that the fiber has only partially relaxed from the previous twitch. So it's not well relaxed. Then you start it up again. Why am I yawning? Am I hungry? Something like that. Okay, so we need to hurry up so that we'll finish this muscle. I think I've asked you up to 10 questions in muscle. I asked you 10 more. Yes, the answer is incomplete tetanus, all right? You need to go look up the difference between complete and incomplete tetanus because they can ask you the questions in different ways, all right? They can ask you the question in different ways. So you need to be sure of what they are asking you. Look at this question, for example. Look at this question. Use the same option. If one nerve stimulus arrives at a muscle fiber so soon that the fiber does not relax at all from the previous switch, the most likely result will be dash. This can only be achieved in the laboratory. Only 3 people out of 40 people. Please, if you don't know the answer, put, you guys are, should I stop? What's happening now? You guys are not giving me, or am I lagging? Hold on, let me see. Maybe I'm lagging. Am I lagging? Maybe they cannot see me. What's happening? Okay, now they can see me. Yes, the answer is complete tetanus, all right? You need to know the difference between incomplete and complete. When you're talking about incomplete, it's incomplete is just it's a very fast, a rapid series of muscle contraction where the muscle partially relaxes. It's not as fast as complete, but because here muscle partially relaxes, right? Relaxation is partial before the next step, but complete, right? It's a sustained contraction, sustained smooth muscle contraction, all right? With no relaxation at all, no stimuli at all. Very, very rapid, very, very fast. All right. So that's the difference between the two of them. I hope you understand that. So you need to be sure of which one they're asking you in the exam so that you don't go and choose a wrong one. You understand? Look at this, guys. When acetylcholinesterase outlasts the release of acetylcholine from the synaptic vesicle, the skeletal muscle dash. This one is a very technical question. When acetylcholinesterase outlasts, so you need to know the function. What is the function of acetylcholinesterase? Yes, some people are reading. Thank you so much. So acetylcholinesterase breaks down acetylcholine. So if acetylcholinesterase is there, you understand, it will lead to relaxation. You understand? Acetylcholine causes, contraction. Okay, let's answer very fast questions now. I need you guys to respond very fast if you can. I really want you to respond very fast. These questions are short questions, and I'm not giving option. During muscle contraction, where does calcium bind? During muscle contraction, where does calcium bind? I really wish you guys can be very fast, man. Where does calcium bind? Are you waiting for option? I can't be giving you option in this question. This is a question it will not, it won't even come out because it's too cheap. Just I'm giving it to you so that if you answer it, then we move to another level. You understand? I want to give you a series of very cheap questions now. During muscle contraction, where does calcium bind to? I need everybody to attend this question. We have more than 40 people in the house. I'm not giving you option. If you're waiting for option, no. I play too much. Now you are talking. Troponin. Was that the door or the knob? The door is tropomyosin. The knob is troponin. The hand that is opening it is what? It's calcium. Thank you. You see? You remember this thing. Some of those illustrations, I'll be making a videos on those little illustrations, and I'll be putting it for members only. That's what YouTube told me to do. You understand? For it, that's what they told me to do. They said I should be making some videos specifically for my members community, then the other videos for public. So those beautiful illustrations I usually give for you to remember concepts, I'll be placing them, for microbiology, pathology, pharmacology, most of these your courses you'll be doing before NCLEX. So it will do you a world of good to become member, to join. That is not just now, it's no longer subscribe, it's join and pay money. This thing is so sweet, eh? Okay, guys. Look at this question. Back to business. Increased calcium ion permeability of the presynaptic terminal cell membrane is caused by presynaptic. Presynaptic is asking you. Remember, what does calcium do in the presynaptic cell? Remember, calcium will jump into the presynaptic cell and lead to what? To burst the vesicles and lead to exocytosis. It leads to exocytosis of what? Exocytosis of what? Of the neuromuscular what? Of the neurotransmitters. Of the neurotransmitters. All right. Somebody said depolarization. You are talking about what happens when it moves over to the postsynaptic. But now we are still in the presynaptic, and we are asking you what will make calcium jump into the cell to burst those vesicles. Remember, calcium functions in the presynaptic and the postsynaptic. All right. For the postsynaptic, you see calcium will go and hold the door, right? But for presynaptic, calcium bursts the vesicles. From Mexico, hello, you're welcome. Thank you for joining the channel. All right, try to subscribe and join the community. Okay, so yeah, so increased calcium ion permeability of the presynaptic terminal is caused by what? Exactly, you guys are so correct. It's caused by action potential. So when this is a presynaptic vesicle axon, right? Action potential is flowing down through it. Immediately action potential comes to that knob, you know, that big part. Immediately it comes to that knob, it will automatically cause opening of calcium-gated channels, and calcium will flow inside and burst those vesicles and push the contents of those vesicles out through exocytosis inside the presynaptic or cleft. Do you understand? So when the neurotransmitters and the presynaptic cleft, it leads to what? Opening of those ion gates in the postsynaptic. You understand? Which leads to depolarization, repolarization. All right. Then an action potential is now formed when it gets to threshold in the postsynaptic, which enters through the sarcoplasmic reticulum into the T tubule. All right, pushing calcium out. You understand? I hope you guys get the picture of what I'm trying to describe. Okay, so the answer to that question is an action potential. You're welcome. You're welcome. Thank you. Now, when action potential is generated on that postsynaptic cell, how does it move? That's the question. An action potential for a muscle cell is propagated along. Now, I'll give you options because it goes in a lot of places. So if you can understand one of the places it goes, that will be good for you. Look at this: sarcolemma, sarcoplasmic reticulum, sarcoplasm, tropomyosin, sarcomere, rather. Let's go, guys. Let's go. An action potential for a muscle cell is propagated along the. Okay, somebody said tropomyosin. But remember, tropomyosin is the door. It has nothing to do with action potential. Check it now. Nothing. All right. So tropomyosin is out. Somebody said, let me see. Did somebody say B, sarcoplasmic reticulum? Sarcoplasmic reticulum only has calcium. That's calcium storage points. Did somebody say? Did somebody say sarcoplasm? No. It doesn't enter inside the cell. For real, it doesn't enter inside the cell. Action potential, nah. Did somebody say sarcomere? No, it's not sarcomere. Remember what sarcomere is between this pole and this pole. So the answer is what? Sarcolemma. All right. That's the membrane. It goes along the membrane. Then the next thing, it enters inside in between the two sarcoplasmic reticulums, the terminal parts of the sarcoplasmic reticulums, which we call the T tubule. The T tubule, yes. So it's a T with two sisters. That's what I call it. You see one sister here. One sister is the cistern, which is the terminal part of the sarcoplasmic reticulum. The other sister is the cistern of another reticulum. So when the action potential passes in the middle, those calcium stored at the extreme are pushed inside into the contractile this thing properly, and those calcium jumps to the troponin and hold the troponin, moving the troponin to open the tropomyosin, so that the active site of actin, the myosin laps on the active site of actin. You need to catch this thing in your head. So the answer to that question is sarcolemma. Please don't be confused. All right. Quickly, guys. This question is a question that they have seen a couple of times, and they look at the question. Cross bridges form between binding sites on actin myofilaments and dash. Quickly. I have like 7 more questions. After this, we jump into the pictures. So you need to stay alert. You guys are slowing me down. I won't wait anymore. It's myosin head, all right? Not myosin tail. Yeah, this one is a normal question. All right. I don't want to be slowed down. Yes. I don't want to be slowed down because look at this question. Which statement best describes the goal of medications used to treat myasthenia gravis? If you need to understand, first of all, you need to understand what myasthenia gravis is. Come on, guys, let's go. Come on, let's go. If you are not sure, you write not sure. Quickly. Yes, you guys are so correct. First of all, what is myasthenia gravis? All right, you know that myasthenia gravis is an autoimmune disease. What does it do? You understand? It actually is where the antibodies, antibodies of your body, of the person's body, attacks and destroys the acetylcholine receptors. So the problem is the receptors, just like type 2 diabetes. The problem is the receptors. Those receptors are the neuromuscular junction. So if it breaks down, destroys some of those receptors, even if acetylcholine comes there, What will it activate to cause contraction? Nothing. That's why myasthenia gravis leads to what? Flaccid paralysis. Not spastic. It leads to flaccid paralysis in case of the ask in pathology. All right. So, so because of that, there will be few functional receptors. And when there's few functional receptors, it will impair what? Neuromuscular or transmission, leading to what? Muscle weakness and fatigue. So because of that, what do we do? You understand? Since the ACH, that acetylcholine receptors is reduced, our strategy is what? To increase the amount of acetylcholine. To increase the amount of acetylcholine in the synaptic cleft. So when there is a whole lot of acetylcholine there, it will compensate for the lack of the receptors. So at least the receptors that are still available will be able to catch as many acetylcholine as possible and have it for a long time. Does it make sense? Aha. So because of that, what do we do? There are things that breaks down acetylcholine, which is what? Cholinesterase. Acetylcholinesterase. All right? It breaks down what? Acetylcholine. So because of that, you want to what? Inhibit it, the cholinesterase. You want to inhibit it. You understand? So because we now give what? Drugs like all this neostigmine. You understand? To inhibit that cholinesterase that will break down what? Acetylcholine, thereby allowing acetylcholine to stay longer in the cleft. Does it make sense? To compensate for the reduced number of receptors. So that's what the drug does. That's why if you understand the physiology very well, that's normal, you'll be able to understand what the pathology. And if you understand the pathology, you'll be able to understand what the pharmacology and the medicine behind it. All right? I hope that makes sense. So the answer is E, as you got answered, to inhibit the function of what? Cholinesterase. Look at this question. They want to confuse you with this question. Let me see how many people will be confused. That's the question there. Let me give you the options. So the toxin of Clostridium tetani travels with somatic motor neurons and affects the functioning of their presynaptic neurons. What effect does this have on smooth muscle? Flaccid paralysis, spastic paralysis, lockjaw, no effect, myocardial atrophy. Quickly, guys, quickly. Come on, guys. Come on, let's go. Come on. The toxin of Clostridium tetani travels with somatic motor neurons and affects the functioning of their presynaptic neurons. What effect does this have on smooth muscle? Okay, since people are not responding, let me just go straight to the point because we don't have much time. No effect. And why is there no effect? It's as simple as that. This place says what? Somatic. Somatic is body. For people that don't understand it, please go to my neuro videos and watch it. Please. I have up to 4 neuro videos. Go and watch it. Especially this last one now that talks about autonomic nervous system. Go and watch it. You understand? So that you'll be able to understand this thing. Because this is talking about somatic. And here it's talking about what? Smooth muscle. Smooth muscle is visceral. Okay. So the answer is no effect, all right? If you don't understand it, you can tell me, I can explain. Few questions to go. Look at this question. Quickly, guys. Which of the following best describes the resting membrane potential, RMP? Come on, guys. Which of the following best describes the RMP? Is this question difficult? This is a straightforward question now. The intracellular environment is negatively charged. The intracellular environment has more positively charged sodium. The extracellular environment is negatively charged. It has a voltage of about 75 plus 75 MV. It's dependent upon the absorption of potassium ions by the muscle fiber. What's the answer, guys? Quickly. Yes, that answer is A. The intracellular environment is actually negatively charged, all right? Now look at this question, guys. I posted the option, negative inside, positive outside. Yes. What happens when acetylcholine stimulates its receptors in the neuromuscular junction? What happens? See, that's what I was describing. Immediately acetylcholine now laps in the receptors. What is the first thing that happens? Come on, come on. The next question is already loading. 2 more questions to go. Come on, guys. Come on, come on, come on. We are more than 40 people here. Yes, you guys are so correct. The permeability of the sarcolemma to sodium increases. It increases. Look at this question, guys. Yes, the answer to that B is correct. Immediately, sodium permeability increases, sodium rushes in. Look at this question. If you are lifting a box, someone places extra weight on top of it. For your muscle to continue contracting and lifting the box, the muscle must what? quickly, guys. The last question, I'm not giving you option for it. Yes, the answer to that question is A, recruitment. So this is the last question I'm going to give you for muscle, and I'm not going to give you options, all right? But you have to be very fast so that we jump to the pictures quickly. So for the pictures, we are going to go backwards the way we just went, right? I think it will take us, you guys are not responding so fast, so it will take us some time. And you really need to do faster because I'm having headache. I think I'm hungry. I'm having headache, serious headache. Probably I'm hungry. So I need to leave you guys quickly. So if you can ask, no, nobody's answering. Overlapping thick and thin filaments is called what? The area where you see overlapping thin and thick filaments. Okay, let me give you option. A band, H band, I band, M line, Z disc. Come on, guys. Everybody should answer that question. Okay, yes. The answer to that question is A band. Answer to that question is A band. Okay, so let me give you. So let's go to some pictures, images. Very important images that you need to be aware of. Let me start from the beginning. From chemistry. Are you guys ready? Oh, you are sleepy? Are you sleepy? We are here. Okay. And that's good. We are ready. Beautiful. Exactly what I need right now. I need that energy. Mm, 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 mm. Say I'm ready. Nothing. Okay. For chemistry, I'm not seeing any interesting picture there. So I'm leaving chemistry. I'm going to next one should be cell. I know somebody is doing like this. Ah, thank God, thank God, thank God. Hey, God, interesting. You guys are cute. Okay. Let's see. Just I hope you're not sleepy. Just give me a moment. I really don't want to get something. Aha! Look at this picture. Listen, for this picture part, I'll be very fast, all right? You see this picture? You have to know this picture, all right? They will ask you, you need to know what A, B, C, D, E, F is, specifically F. You need to know what F is. So, guys, what is F? What's F? Hey, guys. Okay, good. Somebody still remembered. And what is I? F is stellate, right? What is I? Okay, fusiform. Okay. You guys are very radio. Then why am I? I should not be stressing now. I should not be stressing at all. Hmm. Okay. Whew. Okay, look at this diagram. I'm still in cell. Look at this diagram from McGraw here. And then we ask you questions like, which letter identifies the cytoskeleton, guys? Hmm? Which letter identifies the cytoskeleton? Which one identifies the cytoskeleton? Okay, C, right? C is the cytoskeleton. So which one identifies the carbohydrate? Which one identifies the carbohydrate? Yes, A. A is correct. Eh? Look at this diagram. Yes, A is correct. Look at this diagram. You should be able to identify A to F, guys, because they can ask you any question there. You can identify A to F. Like, for example, which protein would bind a chemical messenger like the neurotransmitter acetylcholine? Which of them will bind acetylcholine, guys? Which one? You know, indirectly, they're asking you which of the protein is a receptor. That's what they're asking you. Quickly. Everybody didn't have to respond. Okay, you guys are so correct. The answer is A, because it's a receptor, right? Binds the first messenger. Look at this question. Which protein would only open at certain voltages? Which option is that? The one that will only open at certain voltages, or voltage, or whatever. Okay, yes, the answer is D. All right, that's a gated channel. All right, so it requires certain potential for it to open up. Sorry. So let's go to genetics quickly. Wait, though, did I jump genetics yesterday? Did I do genetics with you guys yesterday? Is it yesterday or on Friday? Please, can you somebody remember? Did I do genetics on Friday? You did. Okay. Oh, perfect. I never know I did. I never know I did genetics. We did genetics. Okay. If I did genetics, this question, did I ask you people this question? Look at this question before I go to the question. Look at this question. Did I ask this question? I didn't. Please, what is the answer to that question? Everybody, I want you to give me the answer quickly. What was the answer to that question? Okay. That's good. ACGGTA. Okay, fine. Then I breathe down. I was afraid. So now I can breathe easily. All right. So let's try this. What is number 1? What's number 1? What's number 2? What's number 3? Write them like that. 1, 2, 3. That's how I want you to write them. 1, 2, 3. Just write them in one line so that I'll be able to. One, two, three. Use these options if you must. 1, 2, 3. Perfect. You guys are so correct. Number 1 is phosphate group. Number 2 is deoxyribose sugar. Number 3 is nitrogenous base. Okay, chicken. No stress. No stress. I want you guys to write this one also. 1, 2, 3. I want you to write it also. 1, 2, 3. What was the answer? 1, 2, 3. In that order. One, two, three, in that order. Everybody. Don't worry, we're almost done. It's just pictures. How many pictures? So, just few pictures. Okay, so kinetochore is 1, centromere is 2, and sister chromatins is 3. Perfect. Perfecto. Look at this question. See this diagram? So I want you to answer these questions with the diagram. You will give me the question in order. I want it in order. Hold on. The first question, hold on, I want to put the questions, then you can answer. First question, this. Hold on. Second question, this. Yes, and I think that's it. First question, that second question, next. Then look at the options. Okay, guys. So let's heat it up. So I want you to write 1, 2. What was the answer to the 1? What was the answer to 2? Quickly. The first one is which process results in the production of mRNA? Which process results in the production of multiple mRNAs? Pre. The other one is pre. The other one is multiple. Hmm? Hmm? Quickly, guys. Quickly. Which people still understands genetics? Where is everybody now? Come on, energy. These ones are things you've known before now. So creating of new pre-mRNA is known as a transcription, all right? But when you want to do it multiple, it becomes what? Splicing. It's as simple as that. So it's transcription and splicing. What's this process called? What is the process called? What's this process called? Come on now, everybody. We are more than 40 people here. Why are people silent? You should not be snapping or doing whatever. You should be answering the questions first. All right? Because you are spending time doing other things instead of attempting the question. Attempt it, consolidate it in your head. I need 5 more people to respond for me to continue. If not, we'll stop here. I know somebody will pick up phone and call another person. Hello? Have you answered? Answer now so that you can continue. Yes, guys, the answer is translation. That's making of the protein, all right? So let's jump into tissues. Human tissues, right? Are they tissues as a topic? Yes. Let me see. Tissues, yeah. Yes, translation. So let's go to tissues now. Somebody will say, I know he's going to put this thing. I know. That's what you are saying, right? So if I give you this, if you are given this kind of question and you are asked, hold on, let me just put the entire thing. I want you to answer the questions together so that we don't waste time because we already spent 3 hours and I'm not feeling too well. So this is the first kind of question that you'll be asked, and this is another kind of question you'll be asked. I want you to answer. Hold on now. I want you to answer 1, 2, and 3. This is number 3. So you need to write it in one attempt. Okay. These are the 3 of them. What tissue would be found lining the trachea? What tissue would be found lining the vagina? Which tissue would be found lining the lumen of the small intestine? Quickly. Trachea is which one? Everybody has to attempt this question. Okay. So to be fast, what that question is supposed to be BCA. Please, if you got it wrong, correct yourself. The question is BCA. BCA. That's the question. BCA. Let me go to the next question quickly. BCA. And is that all for tissue? Hold on. How can be now? Yes, BCA, guys. Okay, that's all for tissues, guys. Somebody's so happy right now. I know. I'm here to make people happy. So, skin, integumentary system. Thank you. Okay, I'm jumping skin. Somebody's so happy. Say, please keep jumping, keep jumping, keep jumping. What's the time? 11:12. Jesus Christ. After skin, the next thing is bone. Let me see. Bone. One of the problems I'm having right now is that my system is slowing down. So I click it and it takes 125 years. So okay, yes, for bone. Let's say a yam just came out. So look at this image. I hope you can see it very well. I want to put two questions there. So you just tell me and we move together. This is one. And this is two. So I need you to give me the response to these two questions. Is it two? Yes. Give me the answers. Just 1, 2. That's how I want it. You want options? Options A, B, C, D, E. God, come on, guys. Come on. Let's go. What's happening now? You want me to post the options? Let me post the options for you. I posted the option beside it. E, B and C, C, B, B and E. What's the option? Let me see who they will trap with this question. Quickly, guys, we are wasting time. Oh boy. Yes, the answer is B. The first one is B. The second one is B and C, not just B. First one is B because somebody wrote B and B for me. First one is B. The second one is B and C. All right. And that's it for bones. Yes, B, B, and C. That's it for bone tissue. So let's go to muscular tissue. Muscular tissue is extremely important. Extremely important. Especially the diagrams. This is something you may see in your exam. You should be able to identify, at least you know what C is. What is stored within the organelle C? Guys, what is stored in C? What's stored in C, guys? Yes, C is calcium. All right. C is stores calcium. That's the terminal systems. Stores calcium. Look at this question. What is the structure at E primarily composed of? Phospholipid proteins, glycoproteins, adipose, dense connective tissue. What is it primarily composed of? In short, they both the one on E and A. What are they primarily composed of? E and A. E and A. What are they primarily composed of? So you write E, you write A. Options: phospholipids, proteins, glycoproteins, adipose, dense regular connective tissue. E and A in that order. E and A in that order. So we have phospholipids, we have proteins, we have glycoproteins, we have adipose, we have dense regular connective tissue. Quickly, guys, it's supposed to be two options. Two options. I said E, write E, put the answer, then A, put the answer. What are they primarily composed of? Options is phospholipid, proteins, glycoproteins, adipose, dense regular tissue. Quickly now. Yeah, so E is phospholipids, right? E is phospholipids and A is proteins. All right. That's the sarcolemma and the myofilament. So you need to know that. Look at this diagram, guys. Look at this diagram. Should I shrink it a little so that people will be able to see it properly? Look at this diagram. Look at this question. This is the first question. Hold on, let me give you the other question also. Oh. Here is the other question. So I want you to answer them. Say one, this, two, this, in the same line, please. He said 1. I can't hold on much longer. Hey, you better hold on. No, me, I'm not feeling too well. I'm here, and you're saying you can't hold on much longer. Put your leg inside cold water. Or you maybe later you come and watch this stuff now. It's not like it's compulsory. Come on, guys. Come on, guys. Between you see, you guys are the ones that are wasting time. As soon as you put the questions very fast, I would have been done by now. Between what two structures does a cross bridge form? Where do you know what cross bridge is? They're just asking you which one merges to which for contraction to happen. That's what they're asking you. I'm waiting. No, when I get up to 10, we'll continue. Between what two structures does this thing cross bridge? Okay, you guys are so correct. So the cross bridge is between myosin head, that's B, and C, all right, which is the actin. And the calcium binds to the troponin, which is the handle, door handle. That's troponin. So that E is tropomyosin. You see it? The E is tropomyosin. The A is myosin tail, right? Okay. So finally, for muscle, all of you know that this one is a very important question. Okay. So you see that question? You need to, I don't think I should start asking you, okay, what is C in the question? What is C? What is A? And what is okay. Oh yeah, hold on. Let me just let me pose the question. Hold on, so that you answer it in order. Hold on, because if I do it like that, it's faster. You do 1, 2, 3 as we've been doing. If I do it like that, it's faster. This first one. This is the second one. And this is the third. So I want you to put the answer in that order, all right? Yes, I need you to put the answer in that order. Oh boy. Is this very difficult? So the first one is sarcomere. Second one is B. And the third one is Z disc. Okay. So that works. Also, you need to make sure you know everything here. All right. You need Yes, you need to make sure you know everything here. They may be asking you about E, like what is contained in the space at E. You already know that E is the sarcoplasm, right? That's the sarcoplasm. That's the muscle internal cell of the muscle. And they will ask you, when the structure at D opens, what does it let into the cell? Who can tell me the answer? If I get 3 people to tell me the answer, I'll move. When the structure at D opens, what does it let into the cell? When the structure D opens, what does it let into the cell? Perfect. So sodium, all right? And when they ask you what is contained within the structure B, what is in B? Yeah, sodium is correct for that question. But what does they ask you? What is contained within the structure B? Three people, I will move so that I don't waste the time of the people that are active. Yes, that's acetylcholine inside the acetylcholine vesicle. Okay, so we are moving very fast with the speed of light. So that is muscular tissue. Oh boy, tired man. When I did revision for neuro, did I give you diagram? Because if I give you diagram, I'll jump it. Did I give diagram? No? Oh boy. Are you sure? Are you sure I didn't give diagram? 2 no's, 1 yes. I don't know who to believe and who not to believe. Are you saying no just because you want me to do this diagram? So a lot of people are saying yes, and you're saying no. There's no last exam for lab. Everything is in this year exam. So I need you to remember the things. If you don't listen, I'm not going to give questions on these diagrams. I'll just show you the diagram. Go back to that life we did, all right? And look at the questions we discussed on it. So I'm just going to post pictures because I really need to go. I'm feeling very bad right now. Like I'm not feeling myself. Yes, now hey, if you finish my class, then you should be able to teach somebody that course authoritatively. You understand? One of my neighbors, she was in my class in Wagner, and when I finished either AP1 or AP2 for her, she was in the next class. They called her. The school called her as a tutor. She was teaching it. Why wouldn't you know it? You need to be able to know it. You remember this diagram, guys? I hope you remember this diagram. I hope you remember this diagram. These are very important diagrams, and you better like where is CSF found? Okay, where is CSF found, guys? Okay, good night. Where is CSF found in this diagram? Where is CSF found? Where do we give AP? Where do we do spinal tap? This is what you should know for this particular diagram, all right? Since you plan, I'll just accelerate it. Yeah. So you need to know where CSF is found, all right? There are two places. Somebody is saying one. There are actually two places on that diagram where CSF is found. You need to know where they give AP, dural anesthesia, and you need to know where they give what? AP and what? And spinal tap, where they do spinal tap. All right. Remember this diagram. So you go and look at the equations that we're asking, the diagram. Let me see. I think that's it for spinal cord. That's it for spinal cord. Then under brain, let me see if there's any diagram of interest. Oh, yeah. This diagram. Yes, you guys are correct. Look at this diagram. See this diagram? Prosencephaly. And the others. You need to go and know 1, 2, 3, 4, 5. You need to go and know 1, 2, 3, 4, 5. You understand? The prosencephaly, the rhombencephaly, the mesencephaly, the mile and met. You need to go and know these diagrams very, very well. You understand? Prosencephaly divided into tel and die. You need to remember TD something. Tel, encephalon, diencephalon, mesencephalon, met, and mile. Okay. And remember the question. So please go and watch the live that we did, right, on neuro. Go and watch it. After watching it, put comments on it. And you people are not making comments, and it's not nice. People should be making comments after watching any video. Put ready. Sometimes those comments, it's not like they pay me for the comment. They don't. It's just that it makes me know that okay, you really watched it. Do you understand? So that one motivates me to produce more of those videos for you guys. Okay, so that will be that for. Is that it? Yes. Oh, no. This diagram as well. See this diagram? You should go and know these 3 tracts. For people that don't know it, go and know these 3 tracts. The association tracts, the projection tracts, the commissural tract. You need to go and know these tracts. All right. And also, you need to know these 2 things. You get it? You see this yellow, this one that they are pointing right now, and the yellow part. You need to go and know them. All right. What is the function of the indicated brain region? Production of speech. All right. That's that one that they are pointing, and the yellow one is for understanding written language. You need to know the 2 of them. All right. You need to know those diagrams in case of if any of them comes out from you in the exam. So that's under brain. Let me see if there is something of interest. Yes, speech and language in autonomic nervous system. Let me see if there's something of interest. Country of particular interests. Okay, no. This diagram is too complex for you to. I'm going to neglect it. So for special senses, no. The diagram is actually though I discussed this diagram in the video, but just focus on all those questions I discussed in the video. Focus on it many, many times. That's autonomic rather, not special senses. Let me see special senses. Guys, what is this diagram? What is this diagram? Lamella corpuscle, tactile corpuscle, muscle spindle, tendon organ, tactile disc. What is this diagram? Quickly now, quickly. This is the last one, guys. This is the last one. What is this diagram? Yes, muscle spindle. This is a muscle spindle diagram. So what is this? What sensory phenomenon is illustrated here? For people that have seen the video, what sensory, and people that were there when we did that discussion, what sensory phenomenon is found here? Yes, that answer is muscle spindle. What sensory phenomenon is found illustrated here? Pain. In the option, there are all, like 5 types of pain. In the option, we have referred pain, we have spinal gating of pain, we have proprioception, we have emetropia, we have synesthesia. What is it called? Yes, this is referred pain. All right, when the brain, when the heart, having pain, the heart has nociceptors for pain. You understand? It has pain, but the pain, yes. So, but the pain goes to the brain, but the brain is thinking that it's coming from the skin. So the thing start paining the person in the hand. All right. So that is what referred pain. And there is one particular this thing that does not have pain. One particular visceral or system that I discussed in that video that does not have pain. Go to the video and watch it. And after doing that, leave comments, please. Okay. Let me see if there is anything of particular interest. No, if I give you this ear, the ear is too thick for you guys. Okay. I think this should be the last question. I think somebody has seen the video, eh? Okay. The person is vibrating. That's good. That's good. So look at this picture. Let me give you these options and you identify 1, 2, 3, 4 for me. All right. Put all of them in one line, please, if you can. Okay, let's go, guys. 1, 2, 3, 4. One, two, three, four. Quickly, guys. What is happening now? Come on, guys. 1, 2, 3, 4. All the options are in that question. Okay, one of the options is not in the question. Yes, one of the options is not in the question. Let me write it. Was that what was delaying you guys? I've written it. Yes, you guys are so correct. You guys are so correct. The answer to that question is cornea, anterior chamber, posterior chamber, and vitreous chamber, right? Okay. Look at this question, guys. They will ask you the cranial nerves. Yes, you are correct. The cranial nerves for 1, 2, 3. I need you to write the cranial nerves for me. 1, the name of the cranial nerve or the number, whatever that works for you. 2, 3. Quickly, guys. Quickly. If you watch that video, some people are. If you watch that video, I even gave a formula for you to know this thing. Now I will know people that watched and people that didn't. If you watch that video, it's like this. You give it to me quickly. I gave a formula for this thing. Okay, some people actually did watch the video. They are vibrating already. Quickly, guys. Quickly, guys. You don't joke with special senses, so that's why I gave it on time. Gave it on time. You joke with special senses will joke with you. LR6SO4O3. Thank you so much. LR6SO4O3. If you don't understand it, go and watch that video, which is what I told you initially. Finally, yes, thank you. LR6SO4O3. All three, not LR6SO4, then all three. All right. If you say O, maybe, but all three, like every other one, is 3. So look at this, guys. I want you to tell me the name of 1, 2, 3. I explained it in that video. 1, 2, 3 in that order. 1, 2, 3 in that order. One, two, three in that order. One, two, three in that order. This is the last question, though. Hurry up, guys. Hurry up, hurry up, hurry up, please. It's last question. I'm expecting everybody. You are almost 40 here. More than 40. I'm expecting everybody to attempt it. Okay, guys. You don't want to talk. Why don't you want to talk? It's just only 4 people. Okay, fine. Number one is the nerve, all right? Optic nerve. No, you have to go. They could say that the chiasma, you understand, and shared stuffs, fibers. Go watch the video, you understand it because I explained this diagram. They share fibers, all right? Then number two is the tract. They become tract. Then when they get to that terminal, they become what? They become radiation, all right? That's at the optical or visual center in the occipital lobe. Very, very important that you understand this. Please, I'll beg you again, go and watch those 2 videos that I produced last because we didn't discuss the questions, but I discussed them in the video. Very important for you. I can't oversay this, all right? Okay, so that's how we come to the end of our discussion today. We tried. We actually covered a whole lot of things in less than 4 hours. So we really did well. All right. So please try to subscribe if you've not subscribed. Try to join the channel. I don't know how much it is, but try to join the channel. You understand? Don't think you are done with me. You are not done with me. You understand? You still meet me in microbiology. You still meet me in AP2. You still meet me in pathology, even in pharmacology. If you, for people that are going to medical school, for people that are going for AP, and others. So try. Eh? It's very cheap. And I'll give you some premium products soon. Immediately after this semester, I'll start dishing out premium products. And maybe my life will be only for members, probably. Yeah. No, I don't joke with my subscribers. But now I will not be joking with people that are members because membership is different from subscription. I won't be joking with them. So probably from after this semester, next semester, the life will be only for members. All right. Still thinking of how to go about it. So thank you guys. I wish you success in your exams and take care of yourself anywhere you are. Hey God, don't worry, I've not decided yet. Anyway, I am. Doesn't matter. I can take online classes. Food has online classes. It's just that you guys don't know. And other schools, even CSI has online classes. The New York University has online classes. Feminde has online classes. Wagner has online classes. All these universities around me, they have online classes. So you're welcome, all right? You're welcome. Okay? So I will see you guys later. I need to go eat. I'm not eating since. I need to go eat so that this headache will stop. Don't worry, I'm eating just salad. I'm not eating hard this night. Just salad. My weight loss is still in line. My weight loss therapy is still ongoing. Okay, thank you guys. See you whenever I see you. All right. Don't forget to subscribe. Don't forget to like. And after watching every video, please put a like and also make a comment. It's very important for me. Put on your notifications so that you get information. All right. No, no. Say oatmeal. No, I'm not eating oatmeal. I'm eating salad this night. No, I'm not eating oatmeal. No, I'm not eating oatmeal this night. It will be too heavy for me. Yeah, good night. Take care of yourself. All right. Thanks a lot. See you guys later. I know if I don't end this channel, you will not go. End this stream. Let me end it. Bye. Yes, you're welcome. Thank you. Please try to watch those, even if you don't want to watch any video, watch those 2 last videos. For neuro, go and watch the live. After watching it, put comments, write ready there. Please, if you have any question, ask me there. Very important, all right? But those videos are good. All right, thank you so much. I appreciate you guys, all right? Take care of yourself. Take care of yourself, eh? Don't forget to follow the channel. Don't forget to become members in the community. I think it's just $6. Let me eat your money. Okay, take care of yourself. Bye-bye. Good night. I'll be shutting off the stream now.